Hello, everybody. I have the esteemed Elizabeth Emmanuel, nursing and midwifery specialist at Southern Cross University, who is doing us the wonderful service, and I mean our profession and also the scientific literature, of establishing PhDs in chiropractic through SCU. Welcome, Elizabeth.
Thank you.
Liz, what are you doing for chiropractors? How are you nurturing these curious souls that are mostly far advanced in their career? How do you think, what are we nurturing here?
I think I feel I'm nurturing a group of health practitioners who are looking for a way to bring the profession together to some a stronger standing in society and more acceptable in terms of their basic constructs in a united way, so that everybody can benefit. And so I feel that at the moment, from what I understand about chiropractic, there is some dissonance or discontent or lack of unity. And it's something similar to what nursing went through decades ago. And I can see something very similar. And my experience with chiropractors, although I've never understood very well what it is they did, I could see the benefits from their work. And many of them could not quite explain what it is they do, but the result of their practice you could see the positive outcomes in the patients, in my children, in me, and my daughter recently went through pregnancy in England, and where she and her husband moved to England for job opportunities, and they got stuck in the COVID situation where they could not access maternity care like all British people because they were outsiders. And so she believed in chiropractors, and they really helped her go through the pregnancy and the childbirth experience in such a wonderful way with no intervention whatsoever. And I was really worried. And I thought, if it were not for the chiropractor and the midwives who helped her, it should have been in dire straits. So I really feel that, chiropractors at the moment, they know what they're doing, but they just need to articulate it in a better way and find a uniform way, explaining to the world what it is they do. So because what they're doing is something very special and different from other health specialists, and they just need to put the right words to it and right constructs so that it's got a sound foundation and basis.
That's wonderful. I didn't realize you were so steeped into the chiropractic culture through results-driven experience. And we love midwives too, because they kind of were second-class citizens in and out of history too, but highly, highly skilled. And do you have any comments for my fellow professionals that are thinking of this sort of path? What are the strengths and weaknesses that they should look at? And certainly through dissonance and disorganization in our profession does come a need to seek clarity, which is probably a good junction that we're at. So what do you see as strengths and weaknesses that we could observe?
Well, their strength is that whatever it is that they're doing, it's an art. The practice that they have is based on an art, which needs to be articulated. They just know what to do, and they know what to say, and they can pick things up very quickly. But they can't. They don't have the means to communicate this so that it gives it and evidence-based. And when you say evidence-based, it gives it a sound basis. There is, like in nursing, we have the art of nursing. So it's not about being artistic, but it's this that ability to use your skills in such a way that it brings about positive results. So that's the strength that I see. The weakness I see is that within the profession, this is what I have picked up, is that people are very fixed in their own way of thinking and are afraid to look outside the box and give more clarity to constructs or ideas that has been accepted for so long, but they're afraid to break it down and look more clearly, look for the weaknesses and put it out there and say, well, let's develop this. Let's move on from this point to that point so that we can all grow together. We don't all have to think the same way, but we can grow in the same way.
Yes.
That's
Do you see a breakdown of studies in philosophy, clinical, abstract stuff like, Dennis's vitalism and Donald's tone? Do you see a need also for straight kind of clinical results publishing as well, or anything else?
Oh, most definitely. We need to see more clinical results, but not just results that focuses on the spine, because I feel from what I'm gathering that there is more to chiropractic than just the spine. Although that's a specialty area, it is that holistic perspective that doesn't come to the surface, and that the art of putting all this together, being person-centered care, providing person-centered care. This is just sort of used flippantly. It's not given much weight, but it is so important, and so important in that overall care. But I think there needs to be more research, not only in the clinical area, but in the skills, the art of putting that into practice, the art of chiropractic. That needs to be done, and the philosophy needs to develop more robustly, and you don't need just one philosophy. There are different ways of skinning a cat, so long as it makes sense and it relates to what it is that you do. One doesn't need to be so quantitative focused. You also can be qualitative focused. In fact, you can put both of them together. So there's no one way of doing things.
It reminds me of what you've just said, reminds me of the relationship between midwifery and the female, the mother, chiropractic empowering the patient. And I see midwifery as an art, science and philosophy that is basically allowing that human to make choices, to support them in choices, or direct them away from certain choices. So that sort of thing where we're in a context of healing, that we're actually assisting the patient to heal, which is what I gather you mean by extra spinal. It's not just about a back.
Yes, for sure, because you do a lot more than what you give yourselves credit for. That healing is not just physical healing, it's mental healing, holistic healing. It's I've learned a lot from the chiropractors all about Palmer and his ideas. Although he wasn't able to express his ideas fully, you could see where he was coming from. And we should chiropractors should build on it, rather than sort of pick holes into what he came up with, but build on it. And yes, okay, we've moved on. This is a new century. This is what he started off, but we can do more. So that's where I'm coming from. And I've learned a lot from people like Dennis and Donald, and we've got some more students or now
Yes.
in
Who
their
else have we got on board there, Liz? Who else have we got on board? Chiropractic. Simon.
Simon.
Simon Senzon.
Simon, yes.
Joel, is Joel Alcantara
Joel.
under you?
Yep.
Yep.
Yes, so it's great, and it's I think the hardest part is to for me as a supervisor is to see how they can sort of step back and look at things from outside the box,
Right.
and then look in
Yes.
the current situation in the profession.
Yeah.
So that is very exciting to see. But but then I guess they're representative of the profession wanting to take some foothold, stronger foothold globally and within the profession, to say, look, a force to be reckoned with. This is our foundation. These are our basic constructs. This is what we can contribute towards health. So, my reason for supervising outside my field is because I can relate to the health practitioners, the chiropractors. I can relate to that because I'm in a similar profession and I've seen this happen. And it's nice to, what in academia, what we're learning more about is that we, as health practitioners, you don't work in isolation, you work together. You have to be multidisciplinary in your approach. Right. And so it's nice to have not only nurses and midwives as my students, but also to have chiropractors. And I'm just looking for an osteopath now, or somebody different, but it's good.
Yes, well, they're close cousins, the osteopaths, and their philosophy is not much different when push comes to shove. The history is interesting as well. What do you think? Yeah. Can you tell me a bit about the university and something that'll help the chiropractors maybe choose Southern Cross University if they're thinking of other than your marvelous track record to date?
Yes, well, the focus is not on chiropractic. The focus at Southern Cross University is on higher degree research for anybody who's interested in like in the School of Health in health. And it so happened that we have more chiropractors now studying, but the focus is not on one area of health. It's very broad. So whoever wants to come and do a PhD, we have the facilities, we have the expertise, and then it so happened that we started off with Dennis, and his colleagues have followed suit.
Yes, and where is the main campus? Gold Coast?
The main campus really is Lismore in New South Wales,
right.
But yes. the largest campus is the Gold Coast, and it's quite nice. And we can continue with supervision without having to meet face to face. So we often meet online, and we meet regularly every 2 weeks and have a discussion if need be. And the purpose is to make sure that the study is progressive, so that one is not sort of stuck on your own trying to do this research. So it's a very good and strong progressive follow-up through the 3 years.
Now, a PhD seems to me like a huge sacrifice, but I'm sure there are people considering it. So just a quick word on the mechanisms of submitting interest, and is there something like a springboard or catapult to a PhD, something maybe on a lesser level that if I want to practice 25 hours a week, I still can, for instance?
Yes, well, you could start off with an honours degree.
Okay.
right? And to do an honors with is just 1 year, and or you could, and if you've already got enough degrees or qualifications, well, you could go on then to a master's, a
So if I
master
have
of philosophy.
a Bachelor of Science, which most chiropractors have, you could tack
Yeah,
on an honours or a master's after that.
or a master's,
Right.
right? And then if you do have a master's, then you'd go straight to a PhD.
Mm.
Yeah.
And so it'd be a master's purely by coursework, not research, experimentation, or it could be any of those.
Well, it's either. It could be coursework. No, we don't do coursework. We would do a Master of Philosophy. So you would have to choose a particular research topic that you
Okay, so it's
want.
like a thesis anyway. Yeah.
Yeah, like a thesis. Yeah.
Yeah. Wonderful. This is great information, and I know a lot of people that they're itching to get into this sort of thing. And do you have anything else to add to encouraging my colleagues to come on board?
Well, I'd like to encourage you first of all to come on board.
Done. Yes.
You seem very keen on what is it? Collecting data about different ideas within the profession, or people who might like to study. So maybe you could turn this into a study,
Yes.
interviewing people. It's a nice way to start off should you be interested. But the nicest thing about the students, the chiropractors were studying PhD at the university, there's a great camaraderie between them, and the supportive of each other, which is really, really nice, because it makes a huge difference. You need that support with your colleagues. And prior to COVID, we would have a conference every year, and the students would come from whatever part of the world they'd come, and they would meet with all their domestic Australian students, and they would also meet all the supervisors, and they really enjoyed that experience. And then we also have a postgraduate association run by students themselves, and so that's another conference they come to. So they would come for 2 conferences a year, and that meeting point at the Gold Coast is something they really enjoyed, and it really spurred them on to continue with their studies. And I found that was one of the great attractions for students coming.
Wonderful.
Chiropractic students coming. Yeah.
I think camaraderie is important, and that, to me, that's the essence of university. The university, they say, has degenerated into this and focused on the wrong things, and it's no longer a place of thought and learning. I tell you what, I have been mixing with your students and my colleagues who are involved in your program, and I don't believe that about Southern Cross University at all. And I'm not even part of the program yet, and may never be. I might be, but I'll tell you right now, I think you're on the right track. And on that note, I want to thank you for participating, and I think I'm going to talk to you very soon.
Lovely. Thank you, Joe. Lovely talking to you.
Thank you, Elizabeth. Thank you very much.
Okay. Bye-bye.